Now, without further ado, I will hand over to Dr. Tedros for his opening remarks and to introduce our guest. Dr. Tedros, you have the floor.
Thank you, Fadila. Good morning, good afternoon, and good evening. Tomorrow marks 1 year since I declared a public health emergency of international concern over the outbreak of novel coronavirus, the highest level of alarm under international law. At the time, there were fewer than 100 cases of the disease we now call COVID-19, and no deaths outside China. This week, we reached 100 million reported cases. More cases have been reported in the past 2 weeks than during the first 6 months of the pandemic. A year ago, I said the world had a window of opportunity to prevent widespread transmission of this new virus. Some countries heeded that call, some did not. Now, vaccines are giving us another window of opportunity to bring the pandemic under control. We must not squander it. The pandemic has exposed and exploited the inequalities of our world. There is now real danger that the very tools that could help to end the pandemic, vaccines, may exacerbate those same inequalities. Vaccine nationalism might serve short-term political goals, but it's ultimately short-sighted and self-defeating. We will not end the pandemic anywhere until we end it everywhere. The world has come to a critical turning point in the pandemic, but it's also a turning point in history. Faced with a common crisis, can nations come together in a common approach? When a village is on fire, it makes no sense for a small group of people to hoard all the extinguishers to defend their own houses. The fire will be put out faster if everyone has an extinguisher and works together in unison. More vaccines are being developed, approved, and produced. There will be enough for everyone. But for now, vaccines are a limited resource. We must use them as effectively and as fairly as we can. If we do that, lives will be saved. That's why I have challenged government and industry leaders to work together to ensure that in the first 100 days of 2021, vaccination of health workers and older people is underway in all countries. My message to governments is to vaccinate your health workers and older people and share excess doses with COVAX so other countries can do the same. My message to people in countries that are now rolling out vaccines is use your voice to advocate for your government to share doses. If you're someone at low risk, please wait your turn. Health and care workers have been on the front lines of the pandemic, but are often underprotected and overexposed. They need vaccines now. They and their families have already paid an extremely high price in this pandemic. Protecting the people who protect us is the right and smart thing to do. In the early days of the pandemic, as you remember, people showed their love and appreciation for health workers by applauding on their balconies. Now it's time to show our love and appreciation for health workers by making sure all health workers are vaccinated. Today, I'm honored to be joined by two health workers who have been delivering health services throughout the pandemic. Harriet Naiga is a midwife from Uganda. Harriet, thank you so much for joining us today. Please tell us about your experience working through the pandemic. You have the floor, Harriet.
Thank you very much, Dr. Tedros. Thank you very much, Dr. Tedros, for this great opportunity. My name is Naiga Harriet from Uganda. I'm a midwife. I'm a director of Milcot. Milcot is midwife-led community transformation, which is a community-based organization which is aiming at bridging the gap which is existing between the midwife and the local community through provision of sexual reproductive health and rights to marginalized adolescents and young adults. So I'm very practical in the community through preventive initiatives. My work is going down to the grassroots to engage with the community adolescents and young adults. However, when the pandemic came in, things changed and I could not access these groups. We could only access them via phone calls. And then when the lockdown was open, we do not have enough SOPs in the marginalized communities. And that means I, as a midwife, together with my team that I lead, we are very, very vulnerable to the disease because the communities that we engage with do not have enough to provide, to prioritize having SOPs in place. So that means we need to be prioritized when the government gets the vaccines in the country, as well as my fellow nurses and midwives whom I engage with, who are in the health facilities, because we do also engage with them as we provide them with resilience, with the knowledge and skills towards the provision of youth-friendly healthy services, but they also tell that they would love to have the vaccines as early as possible because they engage with large numbers of patients, and us as nurses and midwives being on the front line, and we engage with the patients with for more hours than any other health worker. So we need to be prioritized, and we really thank WHO for the move that you have taken on producing the vaccine. That will be very great for us, the nurses and midwives, if it comes. And I appeal to the government for because of the efforts that it is putting in to have the vaccine in place. We also ask the government that when it comes, nurses and midwives are prioritized to be vaccinated first. Thank you very much.
And I hear your call that you would love to be vaccinated so that you know you're safe to protect the mothers and children you work with. Thank you so much again. Asante sana, my sister. Now to our second guest, Sana Balok, is a nurse from Pakistan who started her career during the pandemic. Sana, thank you so much for joining us today. And we look forward to hearing about your experience working on the pandemic and your hopes for the year ahead. Sana, you have the floor.
Thank you so much, Dr. Tedros. Thank you for inviting me here. My name is Sana Baloch, and I'm a recent graduate of Science in Nursing from Aga Khan University, Pakistan. I actually started my career as a nurse during the pandemic, where when a student nurse transitions to a professional nurse is itself usually a challenging time where you need the best supervision and best mentorship to do your skills in a clinical side. Unfortunately, we were transit in a time where we were the only ones who had a great responsibility to deal with the patients. Where most of the staff were isolated, they were infected, and they were exposed. The burden and the shortage of staff was huge, and we had a huge influx of patients. We were trained within few weeks to take care of the patients in COVID ICU when there were new units built up in a couple of weeks. So we as nurses, the doctors and paramedics were in a great distress, but yes, we had no escape. It is our moral responsibility and it was our job to take care of those patients. We were the only hope of the patients and the families who were isolated and admitted in COVID wards, and where they were not allowed to meet or to see anybody. We cannot deny this. We cannot leave them alone, but at the same time, we need protection. We need understanding of the policymakers, our managements, and the government to protect us, because by providing the complete PPE and, of course, vaccination, because the PPE is disposable, but the healthcare workers are not disposable. So we thought that the cycle was continuous during the year. The pandemic to 2020, we were exposed, we were isolated, then we just had to wait when we will recover so we can go back and take care of our patients again in the COVID ward. So there were our colleagues who were really sick, who were not able to breathe in, but after 20 days of their hospitalization, they were there standing in the wards and taking care of the patients. Around 10,000 of the healthcare staff has been infected in Pakistan, and more than hundreds were died. And they were not old, they were young, they were our colleagues. And because of less resources, less PPE, and of course now when we talk about the vaccination, it is the responsibility of the world leaders and most developed countries to help the humanity and the healthcare providers first, to protect them so that they are able to deliver the best quality of care and they are safe in order to provide care. Because the healthcare providers are the ones who are not going to any gatherings. They are the ones who are following all the SOPs, but yet they are the most vulnerable. They have to take care of the patients. We had to give the bath, we have to take care to the clothing and everything of COVID patients and people who are on ventilators, unable to breathe. There is no escape, and we as healthcare workers, the doctors, the young doctors, nurses, midwives, and all paramedics look forward to the world that they will decide on the basis of the humanity, because it is not something as state level, it is something as a human being. And we as a world can only fight with the virus when we think of providing safe services to our healthcare providers despite of the borders. So yes, I appeal to the leaders of the world that please distribute the vaccine on equitable categories. If you have enough of the resources to vaccinate all your elderlies and all your healthcare providers, so do consider to donate or help out lesser developed countries who do not have enough to even vaccinate their healthcare providers or elders before moving towards the less vulnerable population of yours. Thank you, Dr. Tedros.
Thank you so much indeed. Thank you. That's very, very clear. So again, thank you, Sana and Harriet, for joining us today. You have my deep respect and admiration for the work you do every day to save lives and deliver health services to those who need them most. We're proud of you. And you have my commitment that we will do everything we can to ensure you and your colleagues are vaccinated as soon as possible. The theme for World Health Day this year is health equity. Equity is at the heart of everything WHO does. This week, we have released 2 products to close gaps in care and improve health outcomes globally. The first is Essential Diagnostics List, a basket of diagnostics that WHO recommends should be available at point of care and in labs to improve timely and life-saving diagnosis. The COVID-19 pandemic has reinforced the value of timely and accurate diagnostics to save lives. Without them, you're flying blind. The latest edition of the Essential Diagnostics List includes tests for the COVID-19 virus, expands the suite of tests for vaccine-preventable and infectious diseases and non-communicable diseases, such as cancer and diabetes, and introduces a section on endocrinology, which is important for reproductive and women's health. The second product is a new 10-year plan for neglected tropical diseases, a set of 20 illnesses that affect more than 1 billion people, most of them poor. The plan includes ambitious but achievable targets to reduce the number of people who need treatment for a neglected tropical disease by 90%, to achieve the elimination of at least one disease in 100 countries, and to eliminate 2 diseases, guinea worm and yaws, globally by 2030. Together, WHO and our partners are working together to ensure neglected tropical diseases are neglected no more. These are just 2 examples of the many ways WHO works every day to fulfill our mission to promote health, keep the world safe, and serve the vulnerable. I thank you. Fadila, back to you.
Thank you, Dr. Tedros. I will now open